Good
Kelly.
morning.
All right, Tracy, you should get it soon.
Just came through. Give me one sec. Okay, it's published. Let me go verify that it is working. Okay, you're good to go.
All right, great. Thank you.
You're welcome.
A meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at 10:02 a.m. on Friday, January 31st, 2025 via Zoom virtual video. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Dr. Van, please confirm that you have verified the identity of all tele and video conference participants.
Yes, ma'am, we have.
Is the sound clear and audible to the public and those on the tele and video conference?
To the best of our determination, it is, ma'am.
Okay. All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. I'm now going to review the mission. The mission of the Occupational Therapy Advisory Committee is ultimately to protect the public, i.e. the consumers of occupational therapy, by regulating competent practice and upholding the standards set forth by the governing rules and regulations. Members present are as follows: Ingrid Frank, Kelly Brandon, Kathleen Norcross, Raylena Crooks, Glenn Wallace, Amy Lariviere, Carolyn Murphy. Glenn, can you confirm that we have a quorum?
Okay, let's see.
B.
Ingrid,
Yeah, we need
me, Ingrid, me, Amy, Kathleen, Kelly. Yes, we do. If we just need 5, then there's at least 5 of us here. So I confirm.
Also present are Dr. Vincent Collada, Executive Director of LSBME, Tracy Morrow, IT Specialist, Amy Christo, Program Specialist, Phyllis Johnson, Licensing Analyst Supervisor, Patricia Wilton, LSBME Executive Counsel, Lauren Suddeth, LSBME Attorney. Before going further, I want to just say Happy New Year to everybody, and that I hope everyone enjoyed the snow as much as I did. I am also thrilled that our current OTAC is together again for 2025. I think we accomplished amazing things in 2024, and I'm really glad we'll be working together again this year. I want to thank Amy Lariviere for being the secretary all through 2024 through ups and downs. She hung in there and did a great job. Thank you, Amy. And I want to welcome and thank Ann Wallace, who's agreed to be the secretary for OTAC for 2025. Also, I guess we need to add to the agenda that we're going to be going into executive session because that wasn't on the original agenda. Do we need to add that?
It is, Ingrid, it is.
It is already on the agenda? Okay,
Yes.
so we don't need to do that. Great. So just for the members, you may not have been aware, we do have some executive session issues that we're going to be talking about after we finish our other business. All right, well then I'll just move straight into the old business of approval of the minutes. The minutes from our meeting of December 13th are up there. Guess you could scroll slowly down on that. Let's see, we did the boring stuff. We reviewed minutes of that meeting. Patricia Wilton gave an update of the rules at that time. We reviewed the fact that we reviewed our telehealth rules that Patricia had created for all licensing entities, and we gave feedback to her about that. We then went into an executive session, discussed some applicant licensure issues, came back and gave an opinion on those. And at the end, we did not address our temporary permitting language in our rules changes that we had made because Dr. Van said we first needed to actually change the law. So I think that's pretty much what we covered. Do we have a motion to approve the minutes?
I motion, Carolyn.
I'll second it, Amy.
All right. Any public comment about the minutes? No public comment yet, Dr. Van, on anything?
No, ma'am, none at this time.
Okay. All in favor of approving the minutes, say aye.
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 Any opposed? All right, the minutes have been approved. Next up for new business, I wanted to, I'm actually going to share the screen. Let me make sure I can share the screen. Let me see if I can share the screen with what I've got.
I will stop sharing. Give me a second.
Okay. Let's see, did this wind up sharing what I wanted it to share? Hold on. Excuse me, y'all. I'm trying to find what. There it is. Okay. Can you guys see a thing that says rules feedback at the top?
Yes.
Yes, it's hard, a little hard to read.
Hard to read. Okay.
Perfect.
So, we, as you guys do know, because I had emailed everybody, our rules were sent to the register. They were open for public comment. We did get some public comments. And Dr. Van contacted me. We reviewed all of the public comments together. And we did feel like there weren't anything that would rise to the threshold of stop the presses, with the comments. But I did want to go over them with y'all to show you what different OTs and CODAs had to say about them. And because some of them we may want to take under consideration for the next time we have to change rules, which, we're going to be changing temp permitting. So we know we're going to be changing the rules again. So I just want to take you through some of the feedback that we received. We got this very first one from several people. It feels like, I think personally, it does feel like something we want to add. I was unaware that there's a new abbreviation for OTs who have received a post-professional doctorate in OT. I thought that they were signing their name OTD, but that's for entry-level therapists, entry-level OTs. For someone who went for a post-professional, the abbreviation is, as shown here, DROT. And several people commented that they would like that abbreviation added as one of the recognized abbreviations for how to call themselves an OT in writing. This person also gave feedback about felt like we had moved too far in terms of OT CODA supervision and wanted there to be a minimum requirement of 2 hours of face-to-face supervision per week for OTAs with less than 2 years experience. And monthly observation of OTAs with 2 to 5 years experience. And that no OTAs should be able to work in home health unless they have 1 year experience. And again, Dr. Van and I felt like the OTAC, we had discussed this extensively, compared ourselves to other states, and we had felt good about this change. So we didn't feel like this was a comment that we needed to stop what we were doing and regroup on this. I hope you guys agree. Then there was another therapist who asked about adding to the list of the ways that OTs can abbreviate what they do, OTR/L, which I actually believe we had meant to do, and I feel like we just failed to do it. She just talked about how in a lot of states people use OTR/L instead of LOTR, and wanted that added to the list. Then another person with another comment about very similar, the abbreviations that we can use. This is coming from a CODA. In reviewing credentials that could be used, would it be appropriate that a practitioner such as myself use the letters LCOTA as appropriate? I did not see that listed. I thought that was a really good thing for us to consider and talk about at a future meeting, potentially. Because right now the C stands for certified, but we don't really have anything in our abbreviations that indicate they're licensed here. Darby sent in a lot of comments, mostly that were grammar related, so I am going to skip those. Then Jennifer Lucky has quite a few. I only have them in yellow and green for visual separation. The yellow and the green don't mean anything. Her first comment was that she felt like any fees should be itemized, meaning like a dollar amount. Again, I think we had all discussed about the fact that going through rules, every time a fee changes, it's cumbersome to go through a rules change process to reflect that. And we made the decision to purposely avoid putting in any fees. Her next comment, she feels like we use the term purposeful activity, but that we don't define it. And her suggestion was either put occupational performance in its place, or I guess the other would be to define it. So that might be something we want to go back and look at for future changes. Her next was about present proof of current certification. Can this be deleted since number 3 requires the applicant to take and pass the NBCOT? Qualification. I actually haven't reviewed this for myself, so we may have to just look at that later. The next comment was, what is the acceptable score on the TOEFL? I believe we did have conversation about this. We decided not to put that on there because the NBCOT has a threshold for the TOEFL, and we are accepting what NBCOT decides. So we did not want to come up with a score for ourselves for the TOEFL.
And we explicitly state that in our rules. I thought we did. I'm just,
Yeah, I think we,
because
yes,
if we do, then it covers that answer. You know, we
Yeah.
can just say that's what that, okay, just
we can
checking.
double check at a future meeting too, though.
Okay,
Today, I just wanted to share all the comments and then we can kind of talk about which ones we feel like we want to revisit for any future changes.
sure.
All right, here's another about the Doctor of OT. So she also mentioned that that is a theme. Continuing professional education requirement. Will LSBME monitor for suitable 1 or hour courses on ethics? I'm pretty sure that we already put in the language that that the ethics course has to be one that's been approved by the LOTA or AOTA or NBCOT. So I don't feel like we need to monitor past that. Yeah, I'd have to get more information from her to understand that because it's pretty clear in there already. Delegated duties and responsibilities. This refers to the section about us, about being on OTAC and how part of the language says that expenses will be reimbursed. This was primarily from when we were meeting in person and when people would have to travel to New Orleans, their mileage would be reimbursed. And I don't know, Dr. Van and Patricia would probably have an opinion about whether it's appropriate to go into further detail in the rules about that. It doesn't feel like it would be.
I think that part of that is some people believe that we are reimbursed just to be on the board, that they don't think it's a voluntary position, because that has come up to me before where they've said that LOTA people are volunteer and OTAC people get paid. And I was like, wait, no, we don't get paid, just reimbursed for our travel expenses if we have them, which we haven't had in 4 years. So maybe that's what they're talking about. They're wanting to know really if we're getting reimbursed for something.
Dr. Van, I see you've got a comment.
Yeah, let me address the latter one and then I'll address the former one.
Okay,
We will reimburse you all, for example, if we feel it's important to send 1 or 2 of you all to a national OT meeting, or you feel it's important to go, and we have the money to pay for it, we will send you, okay? We want you to be able to best represent this information to the board through the advisory committee. So that's something we'll continue to do and have done. Since we don't travel much anymore and for regular meetings, we do still have that in there if we had to have an in-person meeting, but we don't pay for these meetings. So again, I think that they can look up, I mean, how we do it is defined, I think, adequately enough in there, but I'll yield to Ms. Wilton. But those are the kinds of things we want to reimburse you for, because if it's important for you to go to a meeting, we don't want you to go on your dime. We want you to go on the board's dime so that you can bring back the most profitable and usable information from our national meeting for us to modify, address concerns in the area of occupational therapy. Having said that, we do have a continuing professional education requirement that we do monitor, okay? And the course on ethics would have to be approved and submitted to CE broker. So again, we are monitoring that very closely for each renewal. So just so you'll know what's going on. If you don't feel that this answers the question well enough, we can put those changes in next time.
that sounds good to me. I mean, it does, under the part about being reimbursed as members, it does clearly state that it's expenses, which should imply to somebody that it's things you've spent money on and that you're getting reimbursed and not you know, that we're getting some sort of a monetary compensation just for being on a member. But if it's frequently misunderstood, then I guess we could look at that later about making it clearer if we need to.
Yeah, I don't think you need to mess with it. If anybody has a question, we're happy to answer it. Or you all can certainly answer it. And other than that, if they think we're not telling them the truth, they can submit a public records request and we can show them the documentation that you've been paid nothing. So I wouldn't worry about it.
Okay. approval of program sponsors. I don't really remember what she's referring to here. What are the additional nationally accredited organizations who shall be deemed approved by the board? I think we just wanted to have, open language in case, because right now we've identified AOTA, LOTA, and BCOT as our organizations who, if they are sponsoring or approving a course, then we accept it. And we just wanted to be able to add to that in the future. And I don't think we need to make that more specific. We just wanted the possibility of adding to that in the future if we wanted to.
And again, we did have sort of a sea change in the fact that if you really look at the old rules, what was happening was we weren't approving individual courses and that kind of thing. It was all nationally accredited courses that would go through CE Broker in an expeditious fashion.
Then she had a question about when the section where we would waive continuing professional education requirements. How much time would be allotted for the applicant to fulfill those requirements? That's it was sort of one of these one-on-one situations. As a matter of fact, we might be just talking about that today. Where it's an individual thing when we go into executive session and we make a determination about if that's. So I think we have to just leave that open like we already have it also. Her next question was, what constitutes a wellness or community setting for the referral section? That is something we may want to consider if we think we might get a lot of questions about that. Do we want to make that any more specific, or do we want to keep it like it is?
You all really agonized over that, as I recall.
I
I thought you really did an excellent job in getting it defined. I think basically what's going to have to come out is once these rules have been finalized, we may want to put together a little letter to all of the community. We can email blast them selectively and tell them what's new in the rules, what's changed in the rules, and those kind of things.
Yeah, I agree. The referral, what about referral to early intervention? As far as requiring a referral from a specific professional, I would need more information from her about that because I don't really understand what she means unless somebody else has an idea.
Well, this is about, can a PA send a patient to me? Can only a doctor send a patient to me? And we've addressed most of those in the law over the years to address APRNs, PAs, and all of those things. So it's pretty much clear in the law. And it was pretty much clear in the rules. So I'm not sure why she felt it was needed to be asked. But again, if you want to change it now, it's going to delay things. Let's put it on a list to do and we can finish these.
This one, again, I'm not sure about it because we don't specify by setting, other than the fact that we said a school setting would not require a referral, but that's the only setting we pulled out.
And that might be it, Ingrid, because schools do see younger children that are,
Is early intervention through schools? I didn't think it was.
Well, it's not considered early intervention. Maybe somebody else that's worked in there lately, but I mean, we would see kids that were younger, like in daycares that were not attending school. So I don't know what you call it, but that might be what they're talking about. Kelly, did you work in schools?
I did.
You know what I'm talking about? Did y'all see younger children?
We just saw them from three and up.
Okay. I think that's
early intervention.
what it is, but it's 0 to 3.
I
wonder if that's
early,
what she's talking about.
I did early intervention. I'm sorry, I've lost my voice. But we would see kids at daycare, and then sometimes maybe she's referring to like Head Start programs, which is considered like a school for the 3-year-old division. Every now and then they would get one at 2, but mostly 3-year-olds.
So with the the children you were seeing for early intervention, that's a separate program, right, Kathleen? That's not through a school, is it?
Correct. It was early intervention. Maybe they referred them to Head Start, but it was considered, I guess, a school. I mean, like they would call it like pre-K 2 or pre-K 3 Head Start program.
It's more state regulated, unless it's a school, but I don't really know. Are they saying should early intervention children need a referral, or are they asking if it should be under the same guidelines as the educational referral? Is that what the
Probably.
question is?
Yeah, that would be my guess.
Um,
We would need more information, I think.
mhm.
Okay, so intervention process. Should OT practitioner be changed to just OT in regards to modification of the intervention plan? Because under number two, section C states the role of an OT assistant is modification of the intervention plan. I guess we could eventually go back and make sure we're being consistent in what we're saying about the roles of the OT and the OTA between various sections. I thought we were, but off the top of my head, I don't know if we were inconsistent from one section to another. And finally, under the dry needling, the comment was, what will LSBME do with this information? Will there be a registry? In other words, will there be a registry of some sort of OTs who have gone through all of the coursework? I wouldn't think so, Dr. Van. What don't the rules just simply state what we expect of an OT? We're not necessarily going to
Right.
follow up with them, right?
Well, we have not done anything for any of your continuing education. We did say what was the minimum requirement to do this dry needling,
Right.
but again, we don't, unless you think it's necessary to track, we're not going to track it. If the
Yeah,
board
okay.
wants to track it at a later date and tells me to do it, well, we'll do it, but I'm not going to be pushing that right now.
No, my assumption was also just that we were laying out what we considered the minimum standards to be that we expect an OT to educate themselves on before doing dry needling, but they don't have to send it to us to prove it to us. We're not going to track who's done that or anything, but if they get into trouble and they haven't met those minimum requirements, that could make it bad for them. So that's it, y'all. That was the comments.
Can I make a request that, because you said that there would be some comments that we should follow up on and some that are just being discussed. Can you maybe suggest which one you believe that we should follow up on?
Well, I do think we ought to follow up on all of the abbreviations, the LCOTA, the DROT. What do y'all think?
I
Potentially.
I agree.
We don't have a problem reviewing them, but let's make sure that they don't contradict any other healthcare providers, an acronym, so that we get confusion.
Okay, yeah. What else should we say might need further looking at? Title of doctor. The TOEFL, no.
Lynn had mentioned maybe adding the thing about the NBCOT for the TOEFL.
Oh, yeah, I guess make sure we've been consistent. Or can this be deleted? This qualifications for licensure part. I guess we just relook at it. I don't know off the top of my head if we need to, but this part about qualifications for licensure will make sure that we're being consistent. We also maybe need to look at whether we did indeed skip defining purposeful activity.
Yeah, I couldn't find that either. I couldn't find it in the rules.
Add that.
And I think I know what they're talking about the intervention plan, where it says OT and then it says OTP. And I did have a question about that when because I've made a PowerPoint that does the differences.
Okay.
What was changed, and that did hit me because before we used to say that OTAs could modify. And I think what it means is that the OTAs can modify the interventions that they use, but they can't solely modify the plan that included the goals and all of that. So I think it's just the wording might be a little confusing.
Okay,
Because the first sentence says OT and then it says the OTP can modify.
all right. Well, let's look at that back at that one too then.
Well, can I jump in?
Yeah.
This is the time to
Oh.
to make changes that you know already, having considered the public comment. You know, excuse me, you know that it should be changed. You think that's the better decision. We can, because the final submission to the Attorney General post public comment contemplates that there might be some changes related to that. So if there are some long-term things you want to deal with, you can put those on the back burner, so to speak, for a future date. But if there's something right now that you think, wow, that's a really good point, we should fix that, this is the time to fix it.
And it won't have to go back through the whole process with public comment again?
No, but you run the risk of the way, and Pat, if I step on parts of my anatomy, correct me. Patricia, I apologize. If we make when the comment period takes those comments and we want to make a change, what we're going to have to do is make sure that the board knows about it. So it's going to during that period of comment, the board will be appraised of it. The good news is we're moving up a bit more expeditiously with the current chairman to make things move along. So I don't think that'll be an issue. But once it gets sent up to the AG's office, the only changes that the board would probably approve would be the changes that are required to make sure there's no antitrust and that kind of stuff to protect the board member. But again, I think as what Patricia said, if there's something you got to change right now, let's go ahead and get it done, and we can get that done during the comment period. But if it's a wholesale change of a lot of things, the board may get a little uneasy with it, but we'll push it if we need to.
Yeah, no, I agree. I don't think we ought to, some of the long-term concepts that you're talking about, but if you think, because a part of the rationale for this was modernization and updating terminology and so forth, for instance, if you think that those initials need to be added, if you think that's a good idea, I would say go ahead, and the board's not going to balk at doing that, and it's not going to raise any hackles at the archives. You're just adding not archives, register. You're just adding an additional designation. That's the kind of thing I'm talking about. Something y'all all appear, or at least Ingrid was giving me the impression that she thinks, yeah, that we really ought to add that at a future date. I would say add it now because it's not going to cause any waves. I don't know. Lauren may have a different idea.
No, I agree. I was just pulling up the rule just because I haven't done this like a change, and it just says that substantive changes are changes that if the nature of the proposed rule is altered or if the change affects additional or different substantive matters or issues not included. If that were to be the case, then we'd have to hold hold on, sorry, it went away. We'd have to hold a public hearing on the substantive changes preceding the announcement. Would have to be mailed within 10 days, yada yada yada. But these don't sound like substantive changes. So if y'all don't think that change the nature of the rule or are additional and different
No,
matters or
I don't
issues
think.
not included in the notice, I don't think we'd have to have a thing. So these changes would just be, we should make them now before we put in the final report. Because if we wait until after we put in the final report, we'd have to go through this whole rigmarole again.
Okay. All right. Well, then in that case, let me then share the screen with the rules, and we can look at specifically at the section about the abbreviations.
I personally don't think you ought. Some of these folks that are just asking questions, they sound fact specific, And we don't generally write rules for micro factual situations. If there's really a question in someone's mind about the answer to that question, they can ask us for an opinion, et cetera, et cetera. I'm more thinking about some of the technical changes, like the abbreviations that came up.
Okay. I do have the rules changes up because I'd assumed we'd be looking at the temp permitting section. All after I found out after we just learned from Dr. Van what's going on with the law. But are you guys seeing the rules now? Or is everyone still seeing the
Oh, we see the rules.
You're seeing the rules, okay. All right, so what page was page 1912, title of doctor? 1912. Let me make this a little bigger. 1911. Okay, here we go. Can this section B? Well, the CODA was interested. Oh, we put CODA/L. So we did actually include the comment was, can we use LCOTA? But what we do have in there, we covered out licensing for a CODA though. I feel like that's good enough. What do y'all think?
Yeah, if we didn't have it in there, I was going to say then it would need to be in there, but it's in there. And so I would say it needs to be written the same way. It needs to be written that same way. And reflective of, you know, how we want to reference licensed occupational therapists. So like it wouldn't make sense if they say L CODA, but then we decide to say that we're going to change our, LOTR to OTR/L to match the rest of the country. Like I feel like they should both match.
I
So
actually feel like we meant to switch ours to OTRL, and I think we kind of didn't.
so if CODA is written that way
Yeah.
and the rest of the country, writes theirs the other way, I would be in favor of changing ours to reflect how everyone else in the country says it and the fact that our CODAs have to write it that way also.
Me too. I don't know. Does anybody else have an opinion about switching LOTR to OTRL/L?
This is Raylena. I'm going to be honest. I'm also licensed in California, and I never knew that it was really that big of a deal. I had asked my supervisor here at the VA when I moved here to Louisiana, which she preferred, and she told me it didn't matter. So I've always signed OTR/L, even here in Louisiana. So I didn't realize that there was any consequence if I didn't. So
It probably doesn't matter. We probably literally could write or LOTR or OTR/L. Yeah, or OTR. And it wouldn't make any difference. For CODA, we could probably put CODA/L or LCOTA, like because it really probably wouldn't make any difference. One way or the other.
I think I think we should pick one because I think it does make I think it helps with consistency. Like when you have a certificate or your degree or whatever, whatever's going to have your designation on there. It would be nice for us to at least take an official position as to what we recommend. Now, if we're not going to, penalize people for using the wrong thing, that's one thing, but I think an official recommendation is another.
All right. Any other thoughts? I mean, I would be fine with us taking a a quick vote to change LOTR to OTR/L. And then we'll move on to the DRO. Well, no, let's do it all at the same time. So, and does anybody else have a problem or an issue with if we change this language, this LOTR to OTR/L?
Are we sure that this is what CODA is utilizing now?
Well, actually, we switched back to OTs from CODAs.
So what is the certification agency utilizing?
For occupational therapists,
Yeah,
like at a national level, most commonly you see OTR/L across the country, as opposed to what we've been doing, which is LOTR. That's not common. I don't think that NBCOT or anybody else has put out any sort of official information about it. I can Google
I
real
don't think
quick.
so either. It's just the R. If you
Yeah, yeah, because that's all.
maintain it. If
about
you don't
their-
maintain the registration, then you can't use the R.
Yeah,
I'm
But
not
the L,
bothered
they
by
don't.
either way. But
I'm sorry. Say that again.
I'm not bothered by either way. I mean, I don't have an opinion if one over the other. That's all.
I do kind of agree that because we already put in there for CODAs, the CODA/L, it would make more sense if we then changed LOTR to OTR/L.
now it's not an or, it's going to be just OTR/L. And
Well,
not,
the other piece, OTR, we said is also okay to use. Any person currently licensed by the board and certified in good standing may use the words licensed or OT. I
But
guess
we're gonna say you
technically
can't-
anybody who's licensed should include the L.
But we're gonna say you cannot use LOTR,
no,
Well,
use OTR/L.
I thought that's what we were doing. I want to get the minutes right so we can correct
I
that
know.
expeditiously.
yeah, I think we're saying, I think we're saying that this sentence here, well,
Which
may
sentence?
use the words licensed occupational therapist registered or occupational therapist registered or OTR/L or OTR. Is that what we're saying? So we're just changing this one thing here. Oop, Lord God, I hope I can read.
So,
Hope I can get rid of that.
so they don't have to have any indication that they're licensed in their abbreviation.
Well, let's talk about that. Like, why do we have that as an option? If they're licensed, why do we have it as an option that they don't have to indicate that with the L?
I kind of like the idea of either LOTR or OTR/L rather than just OTR.
Yeah,
I mean,
know.
we've been doing LOTR for 30 years. I mean, that's gonna be hard to change.
Yeah, that's going to be a hard habit to break. But anytime I go to a conference or anything and I sign my name, LOTR, they're like, "Oh, you're from Louisiana."
Yeah.
Because they know
We're
that we're the
famous.
only state in the.
Yeah, I really,
Indiana OTR. So I mean, I don't know why we just couldn't change just say LOTR or OTR/L. And I mean, OTR without the L shows there's no indication of a license.
I'm fine with that too. I agree. I don't know why we even have an option of not indicating your licensure on here.
Well, I think it's for people who aren't like, who want to maintain, I don't know, like maybe an author. Somebody, I think there's people out there that I feel like there's people out there who aren't licensed to practice occupational therapy that may not maintain that license to practice, but they still might want to remain registered with the board because NBCOT doesn't demand that you're licensed, correct?
Yeah, but in this particular sentence, it specifically says any person currently licensed by the board.
Oh, okay.
and
I'm sorry.
certified. Yeah,
I'm sorry.
so we should not have even put in there as an option of just calling yourself OTR because
Right. Then that
if
needs
you're
to get
licensed,
taken
it should
out.
be indicating that you're licensed. Um,
I hate to throw another wrench in the works here, but I'm afraid I'm gonna have to.
okay,
Um, we probably need the rules consistent with the current law because they're and I'll, if you want to share let me share a screen. I have that out of the statutory requirements. And I think the key for us is this is you may be putting the cart before the horse here. And we've
yeah.
done it before, and it's never a happy sight to see how that goes.
No, well, we completely forgot about looking at the law first, so I'm glad you brought it up, Dr. Van. You are sharing the screen. You can show us which part you mean.
Okay, yeah, thank you. Hold on a minute. Okay, let's see. Share screen. Let's go back. Can you all see that? Can you read it?
Yes.
Okay, so right now it says, and it looks like we tracked the law and what we did. So again, this is what it's saying. Any person who's issued, and you may use the words occupational therapist, licensed occupational therapist, or LOT or OT in connection with his name and place of business. Occupational Therapy Association Louisiana may use the words licensed occupational therapy, like licensed occupational therapist registered, or occupational therapist registered, or LOTR or OTR. And all I'm saying is, if we go beyond the rules, we may have a pitfall that we don't want to fall in, but Miss Patricia is the wizard at that, so I'm going to defer to her.
I'm seeing that under section C, it also is LCOTA, not COTA/L.
Yes, ma'am, I didn't get that far.
So this is what the law currently says. So if we then change it in the rules without having changed it in the law, that's going to be a problem.
Well, the problem is we have to follow the law.
Yeah.
And again, this is one of those things we can clean up this if we have a clear, if you would take this area and clean it up to make sure exactly what you wanted to say.
Yeah.
I'm willing to take a shot because there's going to be a big omnibus bill for lots of healthcare providers. And we can put that in upcoming legislative session. But I can't wait 6 months for that. It'll be over.
Okay.
You're going to have to give me exactly what you want the law to say, and we'll track the rules without any trouble. The rules will track the law without any trouble. You can't have the law follow the rules. The rules have to follow the law.
Okay.
Ms. Wilton, are you in agreement with me?
Yeah, I am. In this case, because the law specifically says how they should be designated, it would probably be an overreach for us to add additional designations. But that is pretty non-controversial, and I think we could probably get the law modernized, and then that would be a very simple add to the rules.
Okay.
But I will need what you want the law to say if I could have it in the next 2 to 3 weeks.
All right. So I guess what I would like us to do then is come to a consensus and still vote on what we would want the law to say. And then I'll create a draft and send it around to make sure everyone was okay with what I created, and then Dr. Van can do his thing.
Yeah,
But we've got a couple of
basically the best thing to do to protect the process so that nobody accuses us of doing things outside of the public records law is to go ahead and say, if everybody, maybe Ingrid, you send that to me, and then
Oh,
I
yeah.
send it to everybody on the committee, and then the committee sends back feedback to me. And if it
Okay.
looks like it's going to be a problem, because somebody wants to tweak it again and change it again, then what's going to happen is we're probably going to have a meeting.
Yeah,
Okay.
you'd have to call a real quick special call meeting because you don't want those deliberations and policy decisions to occur outside the public view.
Okay, well, we'll decide it now. I mean, I think we're gonna be able to come to agreement now.
The law also needs to be changed from AOTA to NBCOT.
Where at on that? Which letter are you looking at?
Well, it used to be certified by AOTA, but
Oh, it sure is under letter B and letter C, both.
yeah, it's all in it.
You're right.
There's a lot of things in the law that aren't correct if we want to go there.
Well,
I think if we can clear this up, and we'll try to do this for you on the fly pretty quickly here, I'm happy to do it. I mean, it's not something that we want you to think we don't want to do, but I think it's better to change the law first and make the rules conform rather than have the rules without having the law in concurrence.
okay, so that will need to be changed to NBCOT. I'm glad you picked up on that, Kelly. Let's start with the part about OTR. Is anyone opposed to removing the option of OTR when you are both licensed and registered? Is everyone okay if we remove that option? Or is anyone opposed to us removing that option?
Can I throw another monkey wrench in the machinery?
Mhm.
I don't think we put consideration of recommended law changes on the agenda.
That's true.
Yeah.
But we are still in public session. If you want to make the motion and add it,
Okay.
we can do it. Thank you for calling that to our attention, Patricia.
Can I get a motion for to add to the agenda of making recommendations for a law changes?
I make a motion to recommend law changes or add it to the agenda.
Thank you, Kelly. And a second?
This is Raylene, I'll second.
All in favor, say aye.
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 Any opposed? Okay, great. Very good. Thank you. We've added that to the agenda at 10:53. Okay, so anybody have a problem with us removing OTR and occupational therapist registered as an option when someone is both licensed and registered? Okay, so then that sends us back to how we want to designate. I've gotten a couple of different opinions. Some who want us to have just one option, maybe OTR/L. Kelly felt like, why can't we keep both OTR/L or LOTR? I guess we'll take a vote. All in favor of having OTR/L only as the only option? Please, I guess, raise your hand or.
It has to be a voice vote. Why don't you just go down the list and call the
Okay.
names?
All right, I'll do that. Thank you very much. So this is a voice vote of your voting either for or against OTR/L being the only option for someone who's both licensed and registered.
I have one quick question. What if you do sign an LOTR and then is that
I don't think
what
anybody's.
happens? You know, like if you're not complying and doing it, because I can tell you it's going to be very hard and there's going to be people that are not going to get this information, even if you send it to them. So what happens if you do sign it, the LOTR? That's my question. And we have rules that you're supposed to do it OTRL. Does that make a difference?
I guess I'd have to ask Patricia, is this really something that would be
Well, technically, it's a rule. You have to follow it. Somebody could make a complaint, and I wouldn't speculate on what investigations would do with that complaint. But in a hypothetical situation, I would imagine they would discuss it with the applicant and suggest that they make that change going forward. I mean, I don't think anybody's going to lose their license over it, but it is going to be a rule, and we don't make rules just to have them ignored. But for anybody to get in trouble for using the wrong designation or an unapproved designation, someone would have to make a complaint.
Okay, that's what I was wondering, or something not valid because you're signing something wrong. That's what I wasn't sure. Because it's going to be very hard. And then what happens one time you put it right, the next time, you know, it's when you've been a therapist for a long time, it's going to be hard to switch it. I'm not saying that I'm against it or for it. I'm okay either way, actually. But I just was curious what happens if you put the wrong thing.
Yeah, that was a
Thank
good
you for
question.
clarifying.
All right, so we will take a voice vote first on who is in favor of having OTR/L as the only option when you're both licensed and registered. I'll go ahead and start with you, Amy. Are you for or against?
It doesn't matter to me, to tell you the truth. I hate to say for or against. I'm okay keeping it. I guess I'm okay keeping it both ways. I'm going to say against only.
Okay. Raylina,
I'm against.
you'd rather, okay, don't want it to be just one. Kelly,
Against?
all right. Glenn,
I I'll stick with I'll stick with everybody, and I'll say against if that's the consensus.
you don't have to.
You don't
I'm-
have to.
Yeah.
You don't
I
have to vote your conscience because
Yeah.
it's going to pass or fail based on
Yeah,
everyone
we're just
voting his or
doing a
her
vote.
conscience.
I mean, I'm kind of for it. I'm kind of for it being just clear that we take that OTAC would recommend a singular designation. And I think it could be worded that way, that like OTAC recommends the following designation, not that
Well, you
I feel
can't
like that.
recommend, yeah, you can't recommend in a rule, but what you could do is you could have have the board put an article in the newsletter or whatever saying that in the process of modernizing the rules, comments were made that some of the designations are outdated or anachronistic, and it is the board's intent in the future to change those and get ready, prepare yourself, whatever, something like that.
I guess I'll say, and maybe you can help me with. I appreciate you saying that. That makes me feel a little bit better. I guess like my desire would be to make Louisiana not the standout state for how we designate our OTPs. Like
Okay.
I
You're
like
voting for it being only OTR/L.
so in that sense, I would say yes.
Okay. Carolyn,
Against.
okay. Kathleen,
Against.
all right, and I'm voting for it but we are outvoted, so we are going to keep both designations as options, OTR/L and LOTR in the language. Okay, moving down then to the codas. We currently have, let's see. In addition, any person certified as an assistant may use, any person who is issued a license as an OTA may use the words OT assistant and licensed OT assistant, or may use the letters OTA or LOTA. Any person certified as an assistant by NBCOT may use licensed certified OT assistant or LCOTA. or CODA. It is complicated. All right, starting with the top part about someone who's been issued a license. Actually, we didn't really vote on this part for the OT. Excuse me, I have to back us up to the OT part again. The next vote is going to be, do we remove the option if a person is licensed? Do we remove the option for them to use just OTR? That's the vote. So I'll go through the list again on that. Amy, are you for or against removing the option of just OTR if someone is licensed?
Remove. So is that 4?
Yes. Okay, Raylina?
4.
Okay. Kelly?
4.
Glenn?
4.
Carolyn?
4.
Kathleen?
4.
And Ingrid? Wait, I feel like I'm missing someone. Carolyn, did I get you?
4.
And I'm also 4. Okay, so we will be removing the option of OTR if someone's licensed. And the words occupational therapist registered.
And what will we be replacing it with?
It's going to say any person licensed and certified or registered by the NBCOT, or I guess we need to change the wording a little bit. I'm gonna have to send it to you. Any person licensed and registered by the NBCOT may use the words licensed occupational therapist registered or licensed occupational therapist. No, occupational therapist registered licensed or LOTR or OTRL. I'm going to have to send it to you, Dr. Van.
Okay, look, that'd be great. And I'll send it, or you could copy both of us, send it to Ms. Wilton as well.
Yeah, I will.
But again, I'm really, there's so much stuff that's going to be added to this law. I don't get enough floor time sometimes on the fourth floor to get it done, but I'm going to do my best.
Once it's all shaken out, this is going to be it's going to be very clear, I think. It just sounds muddy right now. Okay, so now we're down to the CODAs and we've got the same issue. The first line says that a person who's issued a license can use OT assistant or OTA. So do we want to remove that option? If they are licensed, do we want them to have an L in there? So that's the first vote, is if you are in favor of removing the option of just calling yourself an OTA if you are licensed. Hold on. I gotta write something down. Okay.
Yes.
Amy, are you for removing OTA as an option if you are licensed?
I'm not, can I abstain? I'm not sure. It's all going over my head at this moment. I hate to say it.
Raylina?
Yes, I'm for the removal.
Okay. Kelly?
Yes.
Glenn?
I'm for it.
Kathleen?
4.
Okay, I'm for it. And Carolyn?
4.
And also I was for it. Okay, so
Did you
we-
hear me, Ingrid? Were
Carolyn?
you able to hear me? Okay, because my
Yes.
box didn't light up where my picture
Oh.
is. I was just wondering if y'all could hear me.
I
Okay.
did.
Okay.
I love your Southern accent, Carolyn. I love your voice.
I'm so sorry. Well, thank you.
Okay, that was the easy one. So now we have got in the law that a person who's both licensed and certified as an OTA can be an LCOTA. In our new rules, we put COTA/L. Do we want to give them basically the same option we just gave to OTs? That they can use either LCOTA or COTA/L?
Makes sense to
think-
me to make it consistent.
Okay, so this will be our last vote. This is a vote to say that under the CODA section, we're going to add, in addition to LCOTA, like it says right here, we're going to add an option of COTA/L. So you're voting whether you're in favor or not of that, of adding the option of COTA/L. Let me just write that down. Okay.
I'm first. I'll say yes.
Okay.
Favor.
All right. Raylina.
Yes, I'm in favor.
Okay. Kelly.
Yes.
Okay. Glenn.
I'm going to be consistent with my previous vote, and so in that way, I would say no.
All right. Kathleen.
Or
Okay. Carolyn.
Or
And I'm also going to be consistent, and I would have said no, but we are outvoted. So we will be allowing both designations, LCOTA or COTA/L. All right. And we'll be and I'll send this to Dr. Van and Patricia with so that it makes sense. I think
Okay,
it'll make sense
and-
once you see it, Dr. Van.
If it doesn't, I will call you, I promise you. But just so you'll know, the only real change we'd ever planned to make in the law was in this section, and right where my cursor is pointing, that word shall be deleted and the word may will exist there. Okay? And that was the only change in the law we're going to go for, and I'm comfortable with this one as well. Once you get me the clear language, because I keep getting it confused. I was trying to keep up with you on it, but I couldn't do it. So I'm not that great a typist. I'm not a good typist at all. But anyway, so yeah, I don't have a problem with you sending it to me. And if it's a problem, I'll call you. But this, so everybody knows, it's in the same section we plan to change anyway. So it's not going to be a big deal for us to get it, I think, added in there. But I just don't want to not have the time done before we do it.
Okay. All right. Is it okay, Dr. Van, if I go back to the rules and share the screen?
Yeah, I'll get out the way. No problem. Hold on a minute.
Is there, if I could say this, so when we were talking about things that needed to be changed regarding the laws, we talked about abbreviations, and then the other thing was what Kelly brought up. Like Kelly started to bring up the fact that like AOTA needs to be replaced by MBCOT, and if we're switching our conversation to go back to the rules, are we doing so to continue to review the laws that we need to suggest to be changed, or are we going to keep going? Like, are we headed in a different direction, I guess is what I'm asking.
We're done with anything having to do with the law. The last thing I wanted to go back over with the rules and possibly changing in the rules right now is adding the DROT, but that is not addressed in the law. So it's not going to be a conflict with the law.
Okay.
Okay, so we finished all. I'm looking at the rules here, A, B. Okay, use of title of doctor. This is not in our current law. So,
However, it is in a different section of Louisiana law.
yeah, but it didn't have, but the section of Louisiana law doesn't get specific about the initials that an OT is allowed to use, right?
No, all it says is that you can use anything you want, but you must represent yourself to the patient and say verbally what this license is or this doctorate is in. So
Right.
that the only people that this was passed by the LSMS about 3 or 4 years ago. I could be a doctor of osteopathy and I can call myself Doc DO. But that's my degree, but I call myself a doctor because I have either that license to practice medicine and surgery. So again, I think the key for you all to understand is that whether you're an OT, a respiratory therapist with a doctorate degree, you have to say, "Good morning, I'm Dr. Collada. I'm a respiratory therapy doctor, and I want to go over this with you. I have a doctorate in respiratory therapy, and I'm going to work with your physician doctor to make sure we get it straight." The LSMS did this because there were so many people walking in, and you say, "Well, did you see a doctor today?" I said, "Yeah, well, I haven't been here. What are you talking about? You didn't see me." And then it's, who's who. And so it's a lot of times in the hospital when patients and families are at their worst, we're confusing them the most. And that's what the law was an attempt to do. So you can say anything you want in the rules, provided it's concurrent with that law. And I'll have to look up that statute and get it to you. And while you're talking, I'll see if I can find it right now.
So I think what we're basically suggesting is that in this C1, in written communication, use the initials, and we're adding, I'm not gonna be able to, am I gonna be able to edit here? No. Adding DROT, big D, small r, big O, big T, all put together. DROT, OTD, DRPH, PhD, or EDD as applicable, following the licensee's name. Does anybody have a problem with us adding that other, the DROT initials to this list? Or anybody want to talk about it one way or the other?
Can you tell me what section that would be added to so that I can add it right here? I can't see. It's a little harder for me to see on my phone. I'm
I'm
sorry.
on of the rules. We're on page 1912. Title of licensees.
Okay, thanks.
Actually, number 2 almost says that. Followed by an unabbreviated, no, that's not the same thing. Okay, I don't hear anybody bringing anything up about it, so we'll take a vote about adding DROT to the list of initials for written communication. Just write this down. DROT. Okay, I'll start with Amy. Are you for or against adding DROT as one of the approved abbreviations to use?
For.
Raylina,
I'm for.
Kelly,
For.
Glenn,
Or
Kathleen,
For.
Carolyn,
For.
and I was for. Okay. So I think out of all of the recommendations that we got in comments, to me, this was the one that we had the most of. There was more than one person, and a lot of the other were things that can probably just be clarified by asking questions. So is everybody okay with this being the only change we request at this time of our rules? Or does somebody want to go back and look at something else?
I'm okay with this.
Wasn't there something else that you pointed out? I can't remember what it was
Well,
now.
they're missing a definition. I mean, some things
Yeah.
are fairly small and
Adding a definition sounds a little more substantive to me. I'd probably leave that for the next revision.
Okay. Yeah, that's true. We also had a plan to review these every few years, and that's in those rules somewhere too. There will always be another revision.
Assuming we get them passed.
Yeah. Well, that brings us to the
Oh, we're
next,
getting them passed.
that actually brings us to the next part of the agenda, Dr. Van, which was where are we now with the rules now that the comment period is over? What is the
Lauren will give that report right now. I'm sure she'd be happy to tell you.
okay.
Miss
Sorry
Lauren,
about that. I stepped away for a second. What would you need me to report on?
Just the next step after this, now that we're gonna make these little technical changes and then we send it to the AG from here, right?
Yeah, and then so nothing really changes. Like we're not straying from our normal track. So now that we got the public comments in, we're just gonna do the final report and it goes to the AG's office and to the legislature and they review it for antitrust and then we get a report back from them. And that basically covers us if there's ever like a challenge for antitrust because we had a state action review.
Is there like a time frame for getting it to the AG, Lauren? Do you have an estimate on when that'll happen?
Probably by mid-February, because or maybe a week or two. It shouldn't take too long. And then they have their own schedule for as long as it takes them to review it. So this is kind of a lengthier set of rules. Like we just had the polysomnography rules go to them, and I think it took about 3 weeks to a month for that to get back. So I mean, that's the only other one that I've done with the AG in this program, so I'm not really sure like what their turnaround time is.
Okay.
and Amy, just to be clear, so we don't lose anything, would you send your corrections to the rules as well as to the law so we don't miss anything? Especially
Yes.
by like,
It would it be Glenn?
Oh, yeah, Glenn is now our secretary. Yes,
Okay.
between Glenn and I, we're gonna get that to you.
thank you so much.
Okay, next then was an update, I guess, from you, Dr. Van, about changing the law. Well, now we just added, my question was about regarding the temp permitting and changing that one word and what the time frame was on that.
Well, again, we are attaching a number of things to a large omnibus bill regarding healthcare. And there are a number of licensing agencies and matters that have similar things that are going to happen to them. So there's going to be one big bill coming out of LDH, and then this is where I plan to put it.
At this point, do you recommend that we not look at how we would want to change the temp permitting language in the rules? Should we push that to our next meeting because this law
Yeah.
change is going to be a
Again,
while?
Again, the law change, and this is how it's going to work. They're going to draft the bill. They're going to sponsor the bill. They got people to carry the bill. We're going to be available to testify when the bill is heard. And then once the bill is passed, that will be the law that we're hoping it's going to be. Nobody changes anything else, and we'll fight hard to make sure that doesn't happen. And at that point, once it's the law, we operate under the law. If the rules are different, we can fix the rules anytime. But again, the one thing that we were going to take out is that just one word in E, the third word from shall to may, and that's section 3009. And then we're going to go ahead and you're going to give me the ones for the OTA/L and COTA/L and that kind of stuff. And we're going to take out the words American Occupational Therapy Association and put NBCOT. And if we need to, and I'll trust Patricia to tell us how to do it, would we have to go back and define NBCOT, or do we spell it out as a National Board of Occupational Therapist Certification? So again, we'll handle that, and I think that's really all we can go. But once we get the law changed, then we can come back and change the rule terminology.
Got it. All right, we'll push that then to another time. Well, that's all I had on that agenda, so we can do the executive session now.
I haven't received any notification of public comments. Have you, Dr. Van
Oh,
or
that's
Tracy?
right. Thank you. Thank you about public comments.
We have not.
No,
Okay.
there
I'm
aren't
double
any.
checking, just give me a second, and no public comment.
Okay.
Okay. All right, we have 3 investigative matters that are going to require executive session. Can I get a motion to enter executive session?
Mr. Braylon, I'll move to executive session.
Okay,
And
and
Amy will second it.
Amy will second. Any, all in favor, say aye.
Aye.
Aye. Any opposed? Okay, we will now enter executive session at 11:21 a.m.
Okay, just give us a second. You'll move quicker if you hit the button at the bottom of the right-hand corner of your screen in just a minute. Carolyn and Amy, do you see a breakout room button on the right-hand corner of your screen? Carolyn? Carolyn?
Okay. In the matter of identification number 75001, can I get someone to give a motion?
I make a motion to waive the requirements for CEUs for 2024.
And a second.
I'll
Excuse me, can I
second.
get
This is Kelly.
And I have a
Kelly seconded? All in favor of waiving the 2024 CEU requirement, say aye.
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 Any opposed? Okay. For identification number 123618, can I get a motion?
Raylene, I'll make a motion to to grant the waiver to recommend licensure.
Okay, can I get a second for that motion?
I second it, Carolyn.
All in favor of all in favor of the waiver and recommending licensure, say aye.
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 Any opposed? Okay. For case number 288858, can I get a motion?
A motion to grant the waiver upon completion of 30 additional CEUs, 6 of which must be live, and 2 weeks of shadowing.
Can I get a second on that motion?
This is Raylene, I'll second it.
Okay, all in favor, say aye.
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 Any opposed? Okay. That ends our agenda. I did just want to briefly bring up that 3 of the members of OTAC are completely term limited at the end of 2025, myself and Kim and Kelly. And so in maybe not our next meeting, but the one after that, I'll consult with Dr. Van on the best timing for that. We'll need to talk about getting requesting applications and reviewing applications as the year goes on. Our next meeting is going to take place on Friday, March 7th, 2025 at 10 a.m. Is there any public comment?
No, ma'am, there's no public comment at this time.
Okay, then our meeting is adjourned at 12:14 p.m. Thanks, everybody.
Thanks, everybody, for all the hard work. We
Bye.
appreciate it.
Thank y'all.